Welcome to this episode of Your Wellness MD podcast. Family physician and wellness expert, Dr. Daniela Steyn, has meaningful conversations that will take your health to the next level. She explores the connection between a healthy body, mind, and soul, and shares tips that will enable you to thrive. Dr. Steyn has helped thousands of people have a better quality of life by improving their health with science-based knowledge, education, better nutrition, mindfulness, and lifestyle choices. Join us today, empowering you to live your best life with optimal health.
Hi, I'm Dr. Daniela Steyn, and welcome to the Wellness MD podcast. I am so super excited to have Amita with me today. Welcome, Amita.
Thank you. Thank you so much.
So Amita is incredible with everything she does. She's been doing this incredible work making lives better for women with menopause. And I almost don't know where to start, but you're changing the world. You're changing the lives of so many women all over the world. I'm super thrilled to have you on my podcast today. Thanks for being here.
Sure. I'm just doing my little trickle of my karma in the world. That's all I'm trying to do.
Making the world a better place. You're very successful at it. So let's start at the beginning. Amita, tell us a bit about yourself.
Yeah, I come from a high-tech world, not a medical, not a holistic expert, nothing like that, but I come from a family of medical doctors. So my journey was started in the high-tech world, working a high-pressure job and going through perimenopause. And that's a little bit of my story. And before that, I changed my profession like 3-4 times, trying to discover myself. And here I am in front of you doing holistic wellness for perimenopausal women because I suffered in silence. That's what I want to say to all the women out there. Most of us suffer in silence. I did that. I was so embarrassed. I didn't want to tell anyone, not my family, not at work. I was so scared. And then I talked to myself, I'm like, that's not right. Why am I doing all this, suffering in silence? And that's when I started researching and talking about how can we bring this taboo subject out in the open, talk about it.
And break the stigma, yes. And that is why I'm so happy to be talking to you about this, because there's different components what I want to touch on today. The one is from corporate perspective, because that is a very big thing. Women are typically at the height of their career, where they're really at this point where they can now flourish, but then they often step back a little bit because of menopause. I want to go into that. But then there's that cultural taboo as well. So it's kind of the corporate taboo because you're in a man's world. You don't want to talk about women things. But then, so let's start with cultural. Did your mom talk to you or your sisters talk to you about menopause?
No, absolutely not. And that's the thing. A lot of cultures, I don't talk about this. My mom never talked. She didn't even know what menopause. I mean, she knows what menopause is, but she had no clue what perimenopause was or is or whatever. In fact, I had to educate her what she went through and all the symptoms that she was going through. So that's the problem. Your family, your mom, like that's who you're connected with. She never talks about it. You go to gynecologist. My gynecologist never told me that you're going to hit perimenopause and how your hormones are going to fluctuate and why you need to take care of yourself more. At that time, I'm talking a few years back. Now I think things are different. Doctors like you are making amazing difference. But majority of the society,
but there's not enough of us, right? That's part of the reason why I have this podcast, why I wrote my book, because so many people reach out to me and they say, I spoke to my doctor and my doctor doesn't know, my doctor doesn't understand, right? And that's why we have to explain to people. So, and then what symptoms did you have? Because we're not talking about perimenopause. So just for our listeners, menopause is that the word menopause means your menstrual period has stopped. So that's what the Greek word means, menopause. So your menstrual period has stopped.
Yes.
And at the end of your fertile years, it's usually your period might become irregular. So we only know it stopped if you haven't had your period for a full year. So the 1 day anniversary after your last period is the day that you're in menopause.
Mhm.
There's a whole 10 years before that you start
Yes.
having symptoms, and we call that
Yes.
your perimenopausal years.
Yes.
And there are amazing things that you can do to improve your quality of life. It
Mm-hmm.
doesn't have to be hard. You don't have to suffer in silence, but you must know what's going on, because if you don't know, right? So what were the things in your life? How did you know that you've become perimenopausal?
So that's what I'm saying. I started getting these symptoms, and perimenopause, like you rightfully said, starts 10 years before the menopause. And menopause is in your 50, 51, and the perimenopause can start in your late 30s or 40s. And that's exactly what happened to me. And then suddenly I'm sweating like a pig, sitting in meetings. And honestly, I had no clue that I'm in perimenopause. Absolutely clueless. My flow became unusually very, very strong and high, and suddenly I'm wetting myself. I mean, those kind of things, unexpectedly, those kind of things started happening. And then I can't sleep at night. I had no clue that this is perimenopause. I thought, oh, I have few years left until I hit menopause, and I thought I was having heart attack or palpitations or heart disease or some other issues have happening to my body, because I always had a little bit of a liver, not a fatty liver, but high,
Liver
markers.
enzymes, yes.
Yeah, my markers were a little bit on the high, so I thought maybe that's what's happening due to that, or maybe it's happening due to this. So I started experimenting on myself, and that is so wrong, so wrong. And I went to the here, I'm in California. I went here to gynecologist, and nobody just said anything. I said, I did not know. I said, oh. So that was my story. Clueless, completely clueless that I am entering perimenopause. My hormones have started fluctuating. And then also I had problem with my concentration sometimes. I would go to work and I'd forget, what did I say? What did I do? So it impacted my productivity so much because I couldn't think straight. And sometimes in presentations, I will forget some things. All these symptoms started happening to me, and stress. Of course, I was stressed out like crazy because of financial. I needed the job. I couldn't afford to lose my job, and I think that was the biggest stress that I had. Oh my God, they're going to fire me,
Yes,
and that's right. This is a huge thing for women. They get so scared that you have reached a certain level, and suddenly you start getting these symptoms and said, "Oh my God, what if someone lets me go?" And there are younger people who are coming to the workforce who are equally better. So this is so much fear and stigma. And then I was scared. I said, if I go and talk to HR, this is what I'm happening. What if they judge me?
yes.
So that there was a lot of turmoil in my head, mostly in my head. And I did not talk to anyone. And that's what I want to bring out. It's so bad for your health, so bad for your mental health. And the other data, if I look at it in the United States, almost 50% of the workforce in the United States are women over 45.
Yes. Yeah. And that's a big thing. So you say that you're in this corporate career, you were worried that you could lose your job, you didn't want to lose your job. What I often find with women is that they would actually quit their job because they
Yes.
feel they're in a point, you're not comfortable to do presentations if you're suddenly going to break out in a sweat.
Yes.
You're not doing great flourishing at work if you're not sleeping the night before. I mean,
Yes.
sleep is so
Yes.
critical. Your anxiety will be worse, brain fog and concentration will be worse if you didn't sleep. So apart from the
Yeah.
hormonal impact, you now have this lack of sleep. And this emotions that you don't understand it's quite a big thing. So we even have for women who don't necessarily want to go on hormone replacement therapy, but need
Yeah.
help, we even offer cognitive behavioral therapy. And that's really just that opportunity to talk through something and think, am I going to lose my job or not? Do I have to quit this job or not?
Yeah.
Am I disastrifying things? Am I making
Yeah.
it like worse than it really is? Just, and it gets back to what you are really doing, creating a platform to help women to connect with each other, to talk, to say that there are other people going through this. I am not crazy. It is so normal. But saying it's normal doesn't mean that we have to suffer. There are things we can do to improve our quality of life. There are things we can do. to thrive at work. And that's my biggest passion. What I really want to bring across with this podcast, you are so successful in your career. I have so many women who are so successful in their careers. And you're at that point where you're thriving. You're at a point where your kids doesn't need that one-on-one attention anymore. So we should lean in at this point. We shouldn't lean back because of menopausal symptoms. We should lean in.
Yeah, absolutely. And the thing is, this all has to start in smaller micro environments, right? Where women are in groups.
Yes.
Right? So think about it. Where do women congregate at this age? They're at work, or they're in their social setups, or, somewhere they're meeting their friends, or meeting in some kind of thing. So it has to start from some micro environment that even at work, it's okay to talk about or get some resources, get some help, someone like yourself who's accessible at work. Then women can come and talk to you discreetly if they have to. They don't have to feel, oh my God, ashamed or so scared and so embarrassed about all this.
And we are paving the way for women who comes after us. So if I would encourage all our listeners to really consider that, even if you think you're coping, to still have that conversation at work, have that conversation. I have a whole chapter in my book about menopause at the workplace, where women, all the research we've done shows that women are not comfortable talking to men about,
Yes.
they're not comfortable talking to other women about that. But then we as women have a big responsibility to talk, to have this conversation. And then we have an even bigger responsibility if another woman talks to us about that, not to say, oh, when I've gone through menopause, it wasn't this bad, or to minimize someone else's journey. I think that's quite important, our responsibility that we have for other women who comes after us.
Yeah, and that's why, at that time, I just wanted to somehow navigate through these strange symptoms that I started having arbitrarily, unexpectedly, without any knock on the door, right? And that's the other thing that happens to women, at least it happened to me. There was no knock on the door. Oh, today you're going to get this symptoms, or today you're going to get this symptoms.
I wish we had.
This is something like, okay, it's suddenly, you're getting a brain fog, suddenly you're getting a stress and anxiety, not attack, but stress and anxiety.
Yes,
So my God, I'm telling you, I'm so baffled.
Yes.
And people noticed that, why am I so like stressed out, and why am I so kind of a little bit not composed? And other people noticed.
Yeah.
And I'm thinking I'm a very calm person, and why am I getting like this? I was completely baffled.
Yes.
What is happening to me, right? And then and there is so much women can. And the other thing I want to talk about is, you being a medical doctor, the correlation of women not taking care of themselves during the perimenopausal year and the onset of chronic condition as all of us get older.
Yes. Yes.
And that right? Do you want to comment a little bit on the chronic conditions?
Yes, that is quite critical. So we have this golden opportunity during our perimenopausal years. So typically before perimenopause, women are typically more healthy, typically didn't have to think too much about their health. And then also typically for most of my patients, their lives would be wrapped around their children, keeping your children alive, getting your children to thrive, getting your children to their checkups, that they don't really have that space to look after their own life. But at this point, we can have a significant impact in our own health. So to all our listeners, you can change a lot of things. So a lot of our health determinants are not genetic. Only about 5% of cancers are inherited. The others are lifestyle related. Heart disease, dementia, strokes, osteoporosis. Most of those things are lifestyle related. So we have control now with things that we do in our perimenopausal years, how healthy our hearts are going to be, how strong our bones are going to be. I work at a very big hospital where I see people come in with hip fractures in their 70s, 80s all the time. For someone who is very strong, who do muscle strengthening exercises in your 40s, some weight training, maybe some squats, if your muscles are very strong, If it happens, God forbid, that you have a hip fracture in your 70s or 80s, you'll get you will get a operation, and you'll get up the next morning and you'll go home, and you'll live another 20 years till you're 104, very happy. However, if you have very weak muscles because you didn't build muscles in your 40s and 50s, when you want to get up the next day after your operation, you can't, because your leg muscles, if you can't get up out of a chair on your own without your arms, that means your muscles are not strong enough to support your bones. Those people have to stay in hospital with us for 6 weeks while they're working with physio to slowly strengthen. Those people have a risk of dying, 40% risk of dying within the next year if they had this prolonged hospitalization after a hip fracture. That's just because of muscle strength, and that's something you can control now. Ways we can control it is to increase your protein intake. I find most women don't take enough protein. We also culturally, it's often more culturally acceptable for a woman to just have a salad and for a guy to have a bigger protein dish. So that is quite important, to look at our protein intake, to look at muscle strengthening exercises. Culturally, quite often women just want to be skinny. And then we don't realize that we're unhealthy skinny, that it's just, if we do scans around these women's bones, it's just fat around their bones, they're not muscle. So it's not about the circumference of your thighs, it's about how much muscle, isn't it? So that's one thing. Then the next thing is we can actually prevent the osteoporosis and the fracture to start off with, and how we prevent osteoporosis is with estrogen. Your body builds calcium and vitamin D into the bone. If you don't have enough vitamin D, not enough calcium, not enough estrogen, your bones won't be as strong, so there are so many things we can do. Tell me about you, your personal experience. What have you found, because you really come from a holistic perspective, what have you found made the biggest difference in your health?
So I changed my entire lifestyle when I was not as fit, I was not as healthy, during that time. Not that I was unhealthy, but I completely changed my entire diet, my nutrition, and my exercise routine.
How did you change your nutrition? What did you do?
Well, so I have a huge, sort of like a very regimented thing, but I'll cover the highlights here. I started plant-based diet. I used to eat meat most of the time before, but I converted myself to majority of the time plant-based diet. Let go of all the processed food, all the canned food, all fried food, nothing, zero.
That's
completely zero.
Good for you for being able to do that. That's a big thing.
It's hard. It's very hard. It takes time. It's like weaning the kid, right? When the kid doesn't want to let go of you when you're breastfeeding. I'm telling you, this one is harder. There's a little bit, I just wanted to make it a little fun also for women to go through this, become so serious. But so all those things, I literally started learning how to cook properly because earlier I never used to pay attention, fried and all that kind of thing. Let go of sugar. I let go of all the white stuff, the white rice and the white flour, all these things. So there was, it can be very difficult, but you can do it in steps. But I did it like that.
And learning how to cook is a big thing. So I'm board certified with the American College of Lifestyle Medicine.
Oh, wow.
Yes. And I found that very enjoyable, the whole experience, learning everything about lifestyle medicine. And that's one of their pillars, would be a predominantly plant-based nutrition. But then under that, culinary medicine is a big thing. Because if you can't cook and you have to rely on takeout, or you have to rely on someone else providing your food, you're not going to eat as healthily as someone who can cook themselves. And for some people, it is quite daunting, the idea of cooking. But same thing, baby steps. If you start with small things and say, this is how I prepare a zucchini so that it's very good. This is how I make my own hummus, or, this is how I add some protein. This is how.
Yes.
And another concern that my patients often have is they say, oh, they didn't have money for a vegan diet. But If you do it in a smart way and you do it on your own, it is actually less expensive. And I sympathize with that, because if I eat in a vegan way at restaurants, it is more expensive. Or if I get vegan meal delivery. But if you make it yourself, if you soak your own beans and you make your own food, you can eat for way less expensive. You can feed your family. And everything we're talking about now for menopause, we should feed our families like that. Because all the research shows that it does decrease your incidence of cancer. It does decrease your incidence of heart disease, of stroke, of dementia for your loved ones as well. So you're going to try through menopause. You're going to have an incredible time through menopause if you eat this healthy, but your family is going to benefit so much more. Your kids, I always find it devastating when I have patients in the hospital with renal disease and from diabetes. Now they're on dialysis, so they need a machine to take over the work of their kidneys because of lifestyle. And then their parents are still healthy, and then the generation who came after in their 40s, 50s have all this medical illnesses that their parents in their 80s doesn't have, which are just lifestyle, right? It's preventable things, and that's what I'm passionate about, to help people to prevent those illnesses.
Absolutely. And the other thing is, what I did is I actually invested in some kitchen tools, like that make the cooking easy.
Which ones?
Right?
Which ones?
Like
what should they buy?
Like air fryer, right? So, instead of frying vegetables, I would just marinate my sweet potato or some of the butternut squash, put some little oregano, a little bit salt, and a little bit spices, kitchen herbs, actually, not spice, herbs.
Yes.
And then stick it in there and air fry some of the vegetables, and they taste yummier than boiling it and steaming it and doing all those things. So there are ways to make it yummy, right? The food has to be yummy so you can eat it. So those were one of the things, and then the hot pot, the what you call one pot where you stick it in, and so make those things, like simple things like curries, simple curries I would make. I make those, and all the beans, legumes and beans, as you just rightfully said, are so good for us. Now they're hard, so what I do is I soak them overnight. Everything.
Yeah, that's key, because a lot of people come to me and say, "Oh, but they can't eat beans; it makes them gassy." It's because we're doing it wrong. Especially if you didn't grow up knowing how to prepare beans. So you can buy beans bulk for very inexpensive. Key is then to soak them overnight, rinse that water off.
And
you can go ahead. I just want to pause here. So because some people might just block this out and say, "Oh, I can't eat beans." Most of my patients can eat beans if they just prepare it well.
Exactly. Soak them overnight and pressure cook. Just use the pressure cook setting. And I overcook it a little bit so that they're a little bit mushy and easy to digest, right? Otherwise, they're not easy to digest. These are the things. And you don't have to have only beans. You can put some kind of you can make it into like a yummy salad, like put other things, like I will put sometimes zucchini that's lightly air fried or lightly sauteed, or cucumbers, or some little other things to make it a little bit more yummier, is what I'm trying to say, rather than a bulk of beans.
Yes, and there are so many, you can on Instagram follow someone for food ideas. There's a good website, Forks Over Knives. You can get support, and if you can just start by one recipe, to figure out one recipe.
Yes.
And then once you've got that, and also to teach your kids about that, I think it's so important. I found it with our 3 little kids, and to have them go with me to the grocery store, for them to get their buy-in, to help me cook every meal. They are way more likely to eat the food if they help to make it, and you tell everyone, "Oh, this kid cooked this meal and this is so good, and everyone come taste her food." Then even if she didn't want to eat it, if everyone tells her, "Oh, this is so good what you make," she'll take a few more bites.
Absolutely. One of the things that I do to get my protein in, because sometimes I don't like eating egg every single day, and these beans have a lot of protein, like moong dal, right? Moong dal or urad dal, what they call it. It's like a white color thing and the green color thing. So I soak it overnight and I put it in Vitamix, right? Vitamix is great. And I put some ginger, chili, and onions, and some spices and some herbs and all those things, and then I make like a pancake out of it.
Oh, that is so cute. And the things that you're mentioning now, ginger and chili and onions,
Mhm.
these are things that I
Yes.
didn't realize before, because when I would cook, I would just want to cook fast. But then
Yeah.
I did more training in functional medicine and lifestyle medicine and the specific impact different foods have on us.
Yes.
There are so many
Hmm.
antioxidants,
Hmm.
phytonutrients, literally cancer-finding compounds in onion,
Hmm.
in garlic, in chili.
Hmm.
So for
Hmm.
us, adding that to the food isn't what I thought, just extra time. I don't care. It is
Yeah.
literally little things that makes us healthier, preventing disease, feeding every cell in our body. It
Hmm.
nourishes us. Yes, and it has such a big impact 3, 6 months later on how you think, how you function, preventing
Hmm.
dementia. So amazing.
Yeah, so and I would prep it on the weekends, right? On
Oh,
Sunday or Saturday. And this mixture doesn't go bad. It lasts for at least, because it's fresh. 2, 3
yes,
days it lasts. The
yes.
other thing, what I do is in the mornings, actually, I put turmeric root, a little turmeric root, a little ginger root, boil the water, and then put some herbs in it and drink it like an herbal tea. And you can speak for turmeric. Turmeric is amazing for
Yes,
inflammation.
yes, yes. That's a big anti-inflammatory, and that is something we often see during menopause, is that
Mhm,
women comes to us with inflammation. So
mhm.
even if there was something that, sometimes this joint bugged you a little bit, or that knee bugged you a little bit, suddenly, for some reason, when you go through menopause,
Yeah.
all the inflammatory markers in your body just flares up, and people come to us
Yes.
with significant inflammation. And that is for sure something that you can do, is to make these teas with turmeric and ginger. And
Mhm.
it's quite a taste to get used to. So
Yes.
it's a very strong taste, turmeric. So
Mhm.
when I just bought turmeric tea, I was like, whoa, that's a strong. But if you make it yourself, and you can
Mhm.
slowly, your taste buds adapt, and you can slowly get used to it. Yes, and increase your antioxidant intake.
Yeah, the taste is very pungent, very strong, but I
Mm.
put a little honey to soften,
Ah,
yeah, so
lemon.
so that I can a little bit of a honey, a little bit of a lemon juice, and a little bit of some kind of an herb I will put like triphala, and so that's how I try to make it yummier. I try to make all my food yummy so that I can at least take
Big. I've had a patient who I wanted to start on a weight loss diet, and she's like, yeah, she
Mhm.
knows what to eat, just chicken and veg. And I,
Yeah.
no, it's not just chicken and veg. And she's
Yeah.
been over the past 20, 30 years on so many diets, and she knows
Mhm.
exactly what it is. It's just chicken and veg. And her diet has been so bland in such a
Mhm.
way that,
Mhm.
just steamed veggies,
Mhm. Mhm.
that she didn't enjoy her diet, that she kind of
Yes.
saw that as her weight loss diet, that she
Yes.
follows for a certain amount of time to lose weight.
Yes.
And then she goes
Yeah.
back to her regular yummy food. And then she goes back to her bland diet to
Yeah.
lose weight. And then
Mhm.
she goes back to her yummy food. And that kind of sets you up for yo-yo dieting for disaster.
Mhm.
So it's important to learn how to
Mhm.
make food in an inexpensive, fast way that you
Mhm.
enjoy, that your family enjoy. That sets you up for success, right?
Yeah, yeah, and those are the little things that. So the other thing was some of the things that other things I do is I make chutneys, like salsas,
Yes,
different
South Africa.
salsas.
We're big on
Yeah,
chutney in South Africa. Yes.
yeah, different salsas you can make, from tomatillos, the green tomatillos, the red tomatillos, coriander is great to make, put some onion, like onion, tomato, and chili, and a little bit of ginger, and you've got your green chutney that you can have with any foods, doesn't matter, right?
Can add
These,
that. My son likes that. Especially
yeah.
if it's food that he doesn't like, then he'll just add enough of very spicy sauces so he doesn't taste it.
And coriander is great. Parsley is great. All
Yes.
these herbs are
Antioxidant.
so good. So I try to incorporate these herbs in my daily cooking, and
Smart.
and that helps me because it gives my inflammation in check. All those things. But I try to do not every herb, but at least 2, 3 key herbs: oregano, parsley, coriander. These are my staple herbs.
And do you use them fresh or do you use them dried?
So parsley and coriander, I try to use fresh. Then the fenugreek is great, fenugreek seeds and fenugreek also otherwise. So that I use it dry. Oregano, I use it dry. Even parsley, I use it dry. Holy basil, sometimes I use it fresh, sometimes I use it dry. So there's a lot of herbs that all of us can use. Even when someone is eating chicken or fish, like which I do, I eat fish. I will marinate a fish a few hours before, a little bit of olive oil or avocado oil. I'll put a little bit of herbs, these herbs that I'm talking about. And the taste is so much better. And of course, other little spices, garam masala, coriander masala, coriander powder, actually, not masala, cumin powder. These are really great spices, kitchen herb spices, coriander, cumin, all these things. So you sprinkle a little bit and then just saute it. It tastes so much better.
Yes, yes.
Anyway,
Yes,
a lot of cooking. We're talking about cooking now. It's become a cooking show today.
But that is so important. That reminds me, do a couple more YouTube videos or TikTok videos specifically on that, because people often ask me, I often see with my patients, that is often a barrier to healthy eating. And then once you've done it, if you've put oregano on your food and the whole house smells like pizza when you bake your food, right? Then people are, that when you enjoy your food more, you're more likely to continue to eat healthy. Lots about food. Next topic. You said you changed your exercise. Tell me a bit about that.
Yeah, so exercise is big. We need movement. Most of us, culture, if you look at the cultural sensitivity, women in a lot of cultures have sedentary lifestyle, maybe not in so much in the United States, but parts of United States and
still,
Canada as
even
well.
in the United States, they say that sitting is the new smoking. We see here in hospital, people with diseases, heart disease, blood clots, stroke, dementia, things literally caused by sitting. Because, and even me, even though I'm a marathon runner and I love running, my day to day, I would easily sit and order my groceries online, not walk through the store or sit. We have such a comfortable lifestyle. We don't walk to go and get water. We don't walk to the market. We don't. So yes, so sitting is a very big thing. Yes, so you are right. Most people still don't get enough exercise.
No, yeah, so I actually during lunchtime I walk every day, so that I start getting some. It's not a brisk walk, but it's enough walk. I try to walk a few miles, and then every single day I try to do something different. Whether it's a body pump, we were talking about the resistance weight training because that's good for your bones. Or I would do dance classes. Dance classes are fun. Yeah.
Fun, great.
Yeah, yoga is great. It has a ton of evidence. All the things we are talking about, yoga can help women so much during this journey. So I don't do every day, but a couple of times. Then I also do HIIT, short interval training.
High intensity training to
High
get the heart
intensity,
rate up.
yes,
And that really
exactly.
helps with weight. That's why a lot of women struggle with weight gain during menopause.
Yes.
But then if you can do those little short intervals where you get your heart rate up, it helps for your cardiovascular health.
Yeah, so I never used to exercise every day, by the way, when I was telling you my story. But this is something, it has happened slowly. I used to find it very boring to exercise and go on the machine and kind of doing myself, even watching TV. Oh my God, I just could not do it. So I had to join these little classes, the groups of women with similar interests. And that's what got me excited, because I look at other women, dancing or doing something else. I say, hey, I can also do it. And this becomes a little bit of a social outlet
Which
as
is
well,
key.
right?
So as I
Yes.
was talking about lifestyle medicine, one of the pillars of health is your social connection. There's so much research showing that you're way more likely to stick to an exercise routine than you do to other people. The people you surround yourself depends how healthy you're going to be. If those women afterwards go for a donut, you'll go for a donut. If those women go for a green smoothie, so, and then there's also science that show that people have less cancer, live longer if you're well connected into a community. So it's so important to invest time, energy into your social connections.
Yes, social connections, community, bonding with the similar interests, and like you said clearly, if I'm doing exercise or the women are doing exercise, we are all doing the same thing. So we are all talking about healthy lifestyle, right? So that's a big thing. Exercise, movement, I should say that rather than exercise, some kind of a movement, incorporating that in your daily routine is so critical.
Yes.
Right?
So that's a big one. And then let's think where we were on. We covered your nutrition, we covered your movement, and then in your personal journey, have you found that you needed to use hormone replacement?
So honestly, I did not even know about hormone
Had the
replacement
option.
had the option until I started looking into for what I'm doing now. And the way, if I had known that hormone replacement is safe, I would have considered that. But nobody told me. I had no clue. So all these contraptions, the holistic therapy things that I'm talking about, I just kind of started doing it by myself with no evidence. Like the other thing what I do, which I should mention to women, is I use medicated oil every single day and I massage myself. This is one of the things that helps me calm down. I massage my head. I do breathing exercises, pranayama. So all these things, little things, help me so much. And I think hormone replacement therapy, well, you're the doctor, can be very useful and it is safe nowadays, but I had no clue.
You didn't know.
I had no clue.
So I would encourage our listeners, and everyone is different. Everyone's journey is different. It doesn't say everyone has to go on hormone therapy, but if you go to your physician and your physician is not sure, because very typically here in Canada as well, if someone comes to me the first time and say they go through menopause, I'd never give hormones right away. I say go and try other strategies first. Then I wait for that person to come back and say other strategies didn't work. If that patient then interprets it as my doctor doesn't want to give me hormones, that patient might go for 10 years without hormones. And then I might only give it to a patient who comes back to me every week and say, I'm not coping, I need something, right? So I really encourage our listeners, so irrespective of what your doctor say, to maybe go onto the website. I can put a link below for the North American Menopause Society. It's, if you look online, www.menopause.org. And there you might find doctors that are more educated on menopause in the United States or in Canada. Or you might they have this information bit for patients specifically, just to kind of educate yourself, for what symptoms do we use estrogen, like for hot flashes, estrogen is very helpful, just look at your symptoms, look if hormone replacement therapy would be a good option for you. There is many other things you can do if you don't want hormone replacement therapy. That was really the heart of my book, why I wrote the whole book, is patients often come to me and say they don't want to go on hormones, but they have these symptoms, what to do. And that's, then, yes. So you can educate yourself, look at my website, look at everything I have to offer. But then, so things that you said that helped specifically in your journey was relaxation strategies, massage oil.
So I want to ask you a question. As a woman, we know that our hormones are getting depleted as we are hitting menopause. Now, those hormones are gone. Should we get the hormone therapy, because those depleted hormones, we want to kind of make sure that we replenish it, getting by hormone therapy? You think?
Good question. So if something happens and you go through menopause early, say you go through menopause in your 30s, then we know that you have to go on hormone replacement, because your risk of a heart attack, osteoporosis are so much bigger than any side effects you might have from therapy. Or if your doctor needs to take out your uterus and ovaries, where most of your estrogen comes from, then you have to, at a young age, you have to go on estrogen replacement.
Okay.
Then, so that's the one group of people. Then the other group of people that go through menopause within the expected years, somewhere between 40 and 60, with the middle 51, but somewhere between 40 and 60.
Yeah.
If they have absolutely no symptoms, they don't have to go on hormone replacement therapy. Okay. If you do have symptoms, The symptoms are typically because you have these estrogen receptors that wants estrogen. Now there's no estrogen, or it fluctuates. Then you get your severe symptoms because you have all these receptors ready for estrogen and there's no estrogen, and then you get symptoms. However, what happens slowly over age is that you get less and less and less and less receptors. So although your estrogen is lower at 70, you won't have that significant symptoms because your estrogen receptors are less. But what happens during menopause is you'll have this burst of estrogen and then nothing, and then a burst. And it's this irregularity that is so hard for your body. And what we do with hormone replacement, the amount of estrogen that we give is much lower than you have with birth control. For example, it's just that little bit to keep your estrogen receptors happy, and then slowly, slowly they can ease off. And every woman's journey is different, right? So some need it, some doesn't. Especially in the workplace, if your symptom is that you're having hot flashes during a presentation, you're dripping water, that would be a very big reason to use estrogen. If you do not have a uterus, you don't need progesterone. If you still have a uterus, we give estrogen with the progesterone. The progesterone helps to protect the uterus from thickening. Because if you get estrogen all the time without the counterbalance of progesterone, you have a higher risk of endometrial cancer. But if we put you on both together, women typically don't. Women sleep much better with that progesterone. They tell me that they really, yes. So it is good to give the combination. The type of estrogen that we would give someone like you that has already a bit of a fatty liver with elevated liver enzymes, is we would typically give an estrogen gel that get absorbed through the skin, because then it bypasses your liver. If you take an estrogen pill, it has to be metabolized through your liver. That does increase, for some people, small increase in the risk of blood clots, liver things. If you use the estrogen gel, you can have a look on that menopause.org of all the products that's available in your country. Then we kind of bypass that liver metabolism, and you don't have that increased risk of blood clots.
Got it. No, I mean, this knowledge, I think majority of the women, millions of women don't understand what to do. And that's, I'm being one of them. And so confused, oh my God, because there were earlier studies in 70s that came in, when I was doing the research on breast cancer. And then it came in at that time, they did not give, both estrogen and progesterone during that study, right?
And it was a different type of estrogen given. It was given to women at a much later stage in their life, not for perimenopausal. Yes, so there was, luckily for us, there's a lot of new research, continuous research being done. So that's good.
Absolutely. Yes.
So tell me a little bit. So you have this tech background, this corporate background. You now are using your expertise to help more women through menopause. Tell us a bit about that.
Yeah, I am just a messiah, right? Evangelist or a messiah. I'm not the expert. What I've done is collaborated with experts like yourself all over the world. And my focus has been initially only on holistic, since I don't understand HRT at all. So I wanted to bring the self-care practices, affordability to women out there all over the world, and the cultural sensitivity as well. As you know, that some cultural women will have menopause at a different age, and the menopause symptoms would be very different, which we didn't talk about it. So I'm bringing things like yoga, things like pranayama, things like acupressure, things like essential oils, these kind of things that we talked a little bit about, the massage, exercise. What can women do to start on a self-care journey? That's what I'm trying to bring, but with evidence and research, not me talking, but the experts who are in this field.
Science show us? And that's critical. So even if women do decide to go on estrogen for the small proportion, they still have to do all the other things, right? Because the estrogen treatment is just 5 or 10% of your treatment plan. You still have to do the 90%, these things that you want to help educate people on.
Yeah, exactly. Awareness part of it. So women don't, if I am perimenopausal, that itself is a big question. Some countries where menopause or perimenopause is happening in their 30s, in countries like, culturally sensitive, like India, for instance, a lot of women are getting earlier menopause. So the fertility gets affected. But I'm not going there. I'm just talking about women who are going through perimenopause. How can they start taking care of themselves using lifestyle medicine, using simple holistic therapies? And that's what I'm trying to do in a very simple way.
Amazing. So tell us a little bit more about this app that you developed, the platform you developed.
Mm-hmm. So the platform is called NourishDoc. So nourishing yourself, doc, NourishDoc.com. And the app is nothing but a simple way based on your symptoms. It will, in bite-sized content, and it will talk about it. It will navigate you simple things like yoga asanas that you can do by yourself, simple breathing exercises that you can do, simple essential oils, simple recipes. We talked a little bit about, we have
Which
a
is
little bit
important
recipes.
because you say that it's simple, but I found so often I will like the breathing. I'll tell my patients in hospital they should do breathing.
Yes.
And they just look at me, yes, I am breathing. And I'm like, no, you have to do these exercises. And then tomorrow when I get there again, I'm like, you have to do these. So if you have that app on your phone, you can just go on that, do the exercises, have recipe ideas. It can be a complete game changer.
Yeah, so you just click, and what we ask at the beginning is the symptom that you're doing, because we don't want to give the wrong recipe for the wrong symptom or wrong whatever, perimenopause, postmenopause. So let's say sleep, or let's say, sleep as an example, then you're probably going to get a recipe using a lavender oil as an essential oil or something else that helps you sleep better, or breathing exercise like called Brahmari Pranayama, or yoga poses like yoga nidra that you could do to help you sleep better. So depending on the symptoms, the yoga asanas or the postures can be also different. The breathing pranayama, what we call it, that can be different. Simple herbs, we were talking about it, Ayurvedic herbs, those could be different. So at least those are the things that we can start incorporating in our daily routine and our daily life to help ourselves live a better quality of life and healthier. And then we need some consultation. Of course, Dr. Danielle is here, and people can talk to you, someone like you, to get some one-on-one consultation or one-on-one advice. So that's the whole idea. Start with the self-care and then bring in the experts as women need.
Okay, yes. So just so that people are not confused, it's people like me on that app. I'm not specifically on that app. My wellness clinic is here in Oakville, and I'm so
yes, absolutely.
booked. Yes, so I don't have one day capacity, unfortunately, to see more people. But that is my heart by giving people access to you, so that people who don't have access to me can have access to access to a physician, access to a healthcare provider. Access to knowledge. Knowledge is power and key.
Absolutely. Access to knowledge, affordable as well.
And equitable and accessible.
Correct. Credible knowledge. And that's what I'm trying to bring, a credible knowledge from experts all over the world, and making sure the women take control of themselves during this phase,
that's
right?
A very big thing, right? To take control of your own health. To have that power. Yes, that's Amita, thank you so much for your time. I'm going to put all your links here below for our audience to listen, because we have audience from all over the world. And we'll have the YouTube video for people to see. This was really, really lovely. Thank you so much for your time, and all the best.
Thank you. Thank you so much for inviting me today. It's been fun. Thank you.
It has been.
Thank you for listening to this episode today by medical doctor Daniela Steyn. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.